Okay, this is Gelila International Seminary for the course in Psychotherapy, Psychotherapy for Psychological Disorder. Now we continue with the chapter 2, Psychological Disorder. The focus of the next two chapters is Too Many in the Heart of Psychology. More focusing on psychological disorder, its explanations, its features, its characteristics is well explained in this chapter. This emphasizes on abnormal psychology basically, which is the application of psychological science to understanding and treating mental disorder. It's appropriate as more psychologists are involved in diagnosis and treatment of psychological disorders than any other fields. Therefore, assessment and treatment of disorder are probably the most important task of psychologists face. About 1 in every 5 American adults, or approximately 44.7 million, are affected by psychological disorder. During any 1 year, National Institute of Mental Health reported in 2017, for example, at least 500 million people are affected worldwide. This indicates that how much the psychological disorder and the issue of mental illness is significantly affecting people. The impact of mental illness is particularly strong on people who are poorer, of low socioeconomic status or socioeconomic class, and from disadvantaged ethnic groups. People with psychological disorder are also stigmatized by the people around them, resulting in shame and embarrassment, as well as prejudice and discrimination against them. Thus, the understanding and treatment of psychological disorder has broad implications for everyday life of many people. Children and adolescents also exhibit high level of mental health disorder. Children from 3 to 70 years of age were identified as having the following disorder based on information collected, for example, from 2005 to 2011 from Center Disease Control and Prevention, CDC. The following is basic characteristics. 1, attention deficit or hyperactivity disorder, ADHD, behavioral and conduct problem, anxiety, depression, autism spectrum disorder. Adolescent age from 12 to 70 were identified having a current diagnosis of illicit drug use disorder, alcohol use disorder, and cigarette dependency disorder. Those are basically listed and more mentioned in your manuals or in your module by persons. It must be noted that psychological disorder frequently occur together. For example, children and adults diagnosed with anxiety disorder also have a depressive disorder, comorbidity. Comorbidity occurs when people who suffer from one disorder also suffer at the same time with other disorder. That's important. So, what does disorder mean? Defining a disorder. According to World Health Organization, WHO, a psychological disorder is a clinically recognizable set of symptoms or behavior associated in most cases with distress and with interference with personal function. Disability includes loss of ability to function in an important area of functioning such as home, school setting, work, or social setting. Psychological disorders have much in common with other medical disorders. They are often out of patient control. They may, in some cases, be treated by drug, and their treatment is often covered by medical insurance. Like medical problems, psychological disorders have both biological, the nature, as well as the environment, the nurture influences. Thus, causal influences are reflected in the biopsychosocial model of mental disorder. The biopsychosocial mental disorder model is basically argue that a way of understanding disorder that assume the disorder is caused by biological, psychological, and social factors. The biological components refer to the influence that come from the functioning of individual body. Particularly important are genetic characteristics that make some people more vulnerable to disorder other than and the influence of neurotransmitter. The second one is the psychological component, refer to the influence that people come from individual, such as pattern of negative thinking and stress response. The third one is the social component, refer to social and cultural factor, such as socioeconomic status, homelessness, abuse, and discriminations. Therefore, more psychologists are involved in diagnosis and treatment of psychological disorders than any other area. Those tasks are probably the most important psychologist face. The impact of people on psychological disorder comes from the disease itself and from the stigma associated with disorder. Therefore, in general, psychological disorder is ongoing pattern of thought, emotion, behavior that cause significant distress or dysfunction, and that is considered deviant in that person, culture, or society. According to biopsychosocial model, to summarize, psychological disorder have biological, psychological, and social cause. It is difficult to diagnose psychological disorder. Also, DSM provide guidelines that are based on the category system. The DSM is periodically revised, taking into consideration new knowledge as well as change in cultural norm about disorder. That is the most important manual for psychologists and psychiatrists. The other one is the anxiety, the OCD and the PTSD is most important. When it's anxiety, the agitation that we sometimes experience, nervousness, often about something that is going to happen, is a natural part of life. Anxiety is an important and useful human emotion. It's associated with the activation of sympathetic nervous system and the psychological, physiological, and biological response that help protect us from danger. However, too much anxiety can be distressing and disleveling, and every year millions of people suffer from anxiety disorder, which are psychological disturbance marked by irrational fear and often everyday objects and the situation. The second one is general anxiety disorder. Chase is probably suffering anxiety disorder as a psychological disorder diagnosed in situation in which a person has been extensively worrying about money, health, work, family life, relationship for at least 6 months, according to APA 2013. In addition to the feeling of anxiety, people who have general anxiety disorder also have experienced a variety of physical symptoms, including irritability, sleep trouble, difficulty concentrating, muscle ache, trembling, and other causes, symptoms. A person cannot deal with what is actually the anxiety nor avoid it because there is no clear cause for anxiety. In fact, the person frequently knows, at least cognitively, that there is really nothing to worry about. The other one is a panic disorder, a psychological disorder characterized by sudden attack of anxiety of terror, known as panic attack, that have led to significant behavioral change in person's life. Have the following symptom: shortness of breath, dizziness, an intense feeling, or others is best example of symptom that panic attacker can display. Panic attack can often be mistaken for heart attack or other serious physical illness, and they may lead the person experiencing them to go to hospital emergency room. Panic attack may last a little as 1 or as much 20 minutes, but they often peak and subside within about 10 minutes. That's important. Now I'm just generalizing what psychological disorder and its types. The other one is a phobia. Is a specific fear of a certain object, situation, or activities that adversely affect individual functioning. The condition is generally lasts for more than 6 months. The fear experience can range from a sense of uneasy to full-blown panic attack. For example, a person with fear of spider, the arachnophobia, may refuse to enter room until it has been checked thoroughly for spider, and may refuse to vacation in the countryside because the spider may be there. That's the phobia. Therefore, phobia are out of proportion to a real danger in situation, taking cultural factor in consideration. And there are other categories of phobia called the specific phobia are unreasonable fear of clearly identified object or situation. For example, a specific phobia include animal, blood, flying in plane, or thundering or lightning. Treatment for specific phobia generally successful, and we will discuss it in the following chapter. The common phobia is a social phobia, for example, also known as social anxiety disorder, which is an extreme discomfort in social situation due to a fear of being negatively evaluated by others or humiliating oneself. Therefore, social phobia may be specific to certain events, such as speaking in public or using public restroom. People with social phobia will often experience physical symptoms in public, such as sweating or nose or dizziness. They are convinced that everybody around them notice the symptom as they are occurring. The other one is agoraphobia, is defined as simply anxiety about being a place or situation from which escape may be difficult or in which they may not be available. Typical places that provoke this anxiety are parking lots, crowding, stress in a shop, whatever it is. The individual must experience this anxiety in at least 2 situations, and the condition must last more than 6 months. People who suffer from agoraphobia may have great difficulty leaving their home and interacting with other people. That's the most important symptom of agoraphobia. The other one is on table 1.1 on your book or on your manuals. Module, the most common phobias is already stated with their name and the description. Now you can read this one by itself. OCD or obsessive compulsive disorder is one way important types of disorder significantly affect people. David Beckham, for example, experience with obsessive behavior is not unusual. We all get a little obsessed at a time. We may continuously replay a favorite song in our head, worry about getting the right outfit for an upcoming party, or find ourselves analyzing a series of numbers that seem to have a certain pattern. Our everyday compulsion can be useful. Going back inside the house once more to be sure that we really did turn off the sink, checking the mirror couple of times to be sure that our hair is combed, are not necessarily bad idea. However, when the checking behavior becomes so persistent and time consuming, it can then become a disorder. That's most important. The other one is PTSD, post-traumatic stress disorder, is simply defined as feel stress and feel that cause distress and interfere with their relief after having been exposed to traumatic event. People who have survived a tribal origin such as sexual assault or abuse or natural disaster or witnessing the death of someone may develop this post-traumatic stress disorder. And it is most important, the fact that behavioral change may include irritability, aggression, recklessness, and self-destructive acts, most important symptom that categorized under behavioral change of PTSD. The symptom may be felt especially when approaching the area where event took place or when the anniversary of that event is near. Diagnosis thresholds are lower for children and adolescents. PTSD affects about 5 million Americans, including victims of 9/11 terror attack. The war in Afghanistan, Iraq, hurricanes, fire, and flood is basically cause for PTSD. That's key. PSD is frequent outcome of childhood or adult sexual abuse. Women are more likely to develop it when compared with that of men. The risk factor for PSD includes the degree of trauma severity, the lack of family and community supports, and additional life stressors. That's a risk factor. Many people with PSD also suffer from another mental disorder, particularly depression, anxiety disorder, and substance abuse. That is key and the most important one. The other one is depression and bipolar disorder. The everyday variation in our feeling of happiness and sadness reflect our mood. Therefore, mood can be defined as a positive and negative feeling that are in background of our everyday experience. In most cases, we are in relatively good mood, and this positive mood has some positive consequence. It encourages us to do what we need to be done, and to make the most of the situation we are in. When we are in good mood, our thought process open up, and we are more likely to approach others. We are more friendly and helpful to others when we are in good mood than when we are in bad mood, and we may think more creatively. On the other hand, when we are in bad mood, we are more likely to prefer to be alone rather than interacting with others. We focus on negative things around us, and our creativity suffers. The other one, most important one, is major depressive disorder. It is not unusual to feel down and low at a time, particularly after a painful event, such as the death of someone close to us and a disappointment at work, in an argument with the person. The depressive disorder are diagnosed with depressive symptom cause a serious distress and negatively influence physical, perceptual, social, and cognitive process. The level of depression observed in people with this disorder vary widely. If depression is deep and lasts 2 or more weeks, the diagnosis may become that of major depressive disorder. The major depressive disorder, also known as clinical disorder, depression, a mental disorder characterized by significant distress or impairment in important area of function. This is Gelila International Seminary for the course Psychotherapy for Psychological Disorder. Those who suffer from major depressive disorder feel intense sadness, despair, and a loss of interest in pursuits that once gave them pleasure. This negative feeling profoundly limits the individual day-to-day functioning and ability to maintain and develop interest in life. Depressive disorder can occur at any age, and the median age of onset is 32 years. The recurrence of depressive episodes is fairly common, and the greatest for those who first experience depression before the age of 50 years. About twice as many women suffer from depression than do men. Their gender difference is consistent across many countries, and it cannot be explained entirely by the fact that women are more likely to seek treatment for their depression. In some, clinically depressed people lose contact with reality and experience delusion and hallucinations. Behavioral associated depression, for example, change in appetites, behavioral associated factors for depression. Change in appetite, weight loss or gain, difficult concentration, remembering detail, making a decision, fatigue, decreased energy, feeling of hopelessness, helplessness, pessimism, increased use of alcohol or drug, irritability, restlessness, lack of interest in activity, hobby of one's pleasure, including sex, loss of interest in personal appearance, persistent ache, pain, headache, and the like, sleep disorder, either trouble sleeping or excessive sleeping, thoughts of suicide, and attempt at suicide is the basic behavioral associated depression. Persistent depression disorder is another one. A significant change in DSM-5 was the consolidation of chronic major depression, resulting in classification of persistent depression disorder. The essential feature of this disorder, meaning that the persistent depression disorder is depressed mood that occur for most days of at least 2 years, 1 year for children or adults. In the full criteria for the major depressive disorder occurs during the time of disorder, the individual should be diagnosed with major depressive disorder. Those individuals are more likely to demonstrate comorbidity with other mental disorder, especially anxiety and substance use abuse, than those identified with major depressive disorder. The other issue is the suicide. The experience of depression can also have a variety of negative effects on our behavior. Individuals may become less productive and socially withdrawn. The person's sense of hopelessness and sadness may become so severe that or she consider attempt or even succeed in committing suicide. In fact, suicide is the 10th leading cause of death in the United States. This implicates that how much this suicide significantly affects people, lead people to death. According to AFSCP, women are more likely to attempt suicide, but men are more likely to succeed. One reason men are more likely to succeed is the method that they chose. Women will more often take an overdose of medication, while men will choose a gun. The other issue is issue relation to bipolar disorder. While major depressive disorder characterized by overwhelming negative mood, a bipolar disorder is simply characterized by a swing in mood and activity from overly high and energetic to sad and fatigued, and back again with period of near normal mood and energy in between. That's most important. The other issue that should discuss in psychological disorder is the issue relation to schizophrenia. According to RAI 2080, the term schizophrenia it comes from Greek words simply meaning that to split the mind. Was first to describe psychological disorder by Bleuler in 1857 to 1939, a Swedish psychiatrist who was studying patients who had very severe thought disorder. That means schizophrenia is simply a serious psychological disorder marked by delusion, hallucination, loss of contact with the reality, inappropriate affect, disorganized speech, social withdrawal, and others. When the patient has lost contact with reality, they are experiencing psychosis. According to name, for example, research conducted in 2010, schizophrenia is the most chronic and debilitating of psychological disorders. It affects male and female equally, although male typically have earlier onset. Schizophrenia occurs in similar rate across ethnicity and across culture, and affects at one time approximately 3 million people in the United States. For example, onset of the schizophrenia is usually between the age 60 to 30, and rarely after the age of 45 or in children. Diagnosing children is more difficult because delusion and hallucination is must be distinguishable from normal fantasy play. That is key and most important. The other disorder is personality disorder. A personality disorder is disorder characterized by inflexible pattern of thinking, feeling, relating to another that cause problem in person, social, and work situations. Personality disorder tend to be merged during late childhood or adolescent or usually continue throughout adulthood. The disorder can be problematic for people who have them, but they are less likely to bring people to therapists for treatment. The personality disorder summarized, for example, in table 10.3, They are categorized into 3 basic types. The first, characterized by odd. The second, characterized by dramatic. The third, characterized by anxious or inhibited behaviors. That is key. Key takeaway is basically, or to make a kind of generalization or summary, ADHD is a behavior disorder characterized by inattention, hyperactivity, and impulsivity that occurs prior to 10 years of age. Autism is a disorder characterized by impaired social interaction and communication, and by restricted repetitive behavior, interest, and activity. Both genetic and prenatal factors are hypothesized to cause ADHD and autism. There is controversy regarding to overdiagnosis of both ADHD and autism. In summary, abnormal psychology is defined as the application of psychological science to understanding and treatment of mental disorder. More psychologists are involved in diagnosis and treatment of psychological disorder than in any other aspect of psychology. The impact of mental illness, particularly strong on people who are poorer, of low socioeconomic class, and from disadvantaged ethnic groups. The biopsychological model is one most important model that basically explains the mental disorder used to explain causes particularly. The psychological disorder is deviant, distressing. Therefore, this biopsychological model is one important model that primarily describes the causes of mental illness. That basically more focusing on 3 most important issues. The cause of mental illness basically one, in one hand, the biological component. The other one is the psychological component. In other side, the social component. From these 3 most important dimensions, they try to reflect and describe the cause of mental illness. The psychological disorder is a deviant, distressing, and dysfunctional pattern of thought, emotion, and behavior. Psychological disorder often comorbid, giving meaning that a given person suffers from more than one disorder. That is most important key. And to summarize in relation to this personality disorder is simply characterized by inflexibility of pattern of thinking and feeling that basically have an effect on social, an effect causes problem on personal, on social and work situations. This can be categorized in different categories. For example, those personality disorder characterized by odd, something deviant, dramatic, erratic behavior, anxious, something inhibited behaviors. That's basically most important. What most important thing is also they are considered separate disorder. The personality disorder is essentially milder version of more severe disorder. Then belonged with the borderline personality disorder, for example, prolonged disturbance of personality, are combined by mood swing, unstable personal relationship, and identify problem and is often associated with suicide. The antisocial personality disorder is characterized by, again, disregard of other rights and a tendency to violate those rights without being concerned about doing so. That's important. Therefore, the stigma of mental disorder affects people while they are ill, while they are healing, and even after they have healed. The stigma. Mental illness is not a fault, and it is important to work to help overcome the stigma associated with disorder. Psychologists diagnose disorder using Diagnostic Statistical Manual, mental DSM. That basically most important manual that helps therapists, counselors to solve in therapy problems related to psychological disorder. Because of the fact that it gives you explanation in relation to risk factor, explanation in relation to cause, explanation in relation to prevalence, explanation sometimes in relation to psychological techniques. That's important. The DSM uses categories, and patient those with close approximation to characterize in the category are said to have that disorder. The current version of DSM-5 TR. Anxiety disorder are psychological disturbance marked by irrational fear, often everyday objects and situation. They include general anxiety disorder, panic disorder, and phobia. Anxiety disorder affect 9% of American adults every year, for example. Obsessive compulsive disorder and post-traumatic stress disorder are another disorder in which anxiety is a major symptom. Major depressive disorder, persistent depressive disorder, bipolar disorder, also involving inappropriate moods that interfere with daily life. The cycle of depression involves negative cognition, leading to negative emotion, leading to negative behavior towards others that ultimately lead to negative response from others that keep the negative cognition active. On the other hand, the schizophrenia is a serious psychological disorder marked by delusion, hallucination, loss of contact with reality, inappropriate affect, disorganized speech, social withdrawal, and the deterioration of adaptive behavior, significantly most important characteristics and feature of schizophrenia. Personality disorder, long-lasting, but frequently less severe disorder, characterized by inflexible pattern of thinking, feeling, or relating to others that cause problem in social, personal, and work situation. Two of the most important personality disorders are borderline personality disorder and antisocial personality disorder. That's important to understand these categories. Attention deficit or hyperactivity disorder and autism spectrum disorder are two disorders identified in childhood. Important to understand this situation in therapy. They are both being diagnosed significantly more frequently than they were in the past. That is key and most important. Thank you very much for your attention, and I thank you again.